Hello, everybody. Welcome back again to my recovery. This chameleon also. Today, I am going to be going over some general, uh, definitions of pretty much what are opiates. I got some paperwork here. Um, this came from the partnership from Drug Free Kids. From go to drugfree.org basically. Um, this whole package mainly deals with kids, but I mean it's also does with teens and all the way up to young adults, and really addiction is for everybody, right? So it's just made for parents to actually help their kids if they think that they're addicted to opioids, and to try to keep them from being addicted to them. So today, what I'm gonna go over is what some common opioids, what they're called, and how they affect the body. And if we have time, maybe I might get into the epidemic and how they how you go from prescription pills all the way up to um, doing fentanyl, right, or heroin. And I'll explain how I did, anyways, how I made the jump. So, what are opioids? Opioids are a class of drugs that include heroin, synthetic opioids such as fentanyl, and prescription pain relievers such as hydrocodone, oxycodone, oxymorphone, morphine, Tylenol with codeine, and more. Opioids have been used for hundreds of years to address pain and since the 1990s to treat chronic pain. And down below here, it's like some of the opioids they have here listed. Prescription pain reliever opioids, which is Oxycontin, Percocet, and Vicodin. It says pain relieving drugs either naturally derived from poppy flowers or lab made semi synthetic substitutes, and the appearance of them is primarily tablets and capsules. And then you have heroin. Some of the common names for that is Big H, black tar, brown sugar, dope, horse, junk, skag, smack, China white, H, white horse. See, we used to call it dog food around here. Heroin is a highly addictive drug derived from morphine, which is obtained from opium poppy plants, otherwise known as opioid. White, its appearance is white to dark brown powder or tar-like substance. Then you have fentanyl and other synthetic opioids. Some common names for that is China Girl, China White, Murder, 8, Tango and Cash, and Pink. Um, I mean, we just called it Fetty. So, and then some of these names here, they could be obviously used for cocaine as well. So, um, but we always called it Fetty. Fentanyl and similar compounds like carfentanil are powerful synthetic opioids, 60 to 100 times more potent than morphine. It shows up in illicit forms that are frequently combined with heroin, cocaine, and other street drugs and carries a high risk of overdose and fatality. The appearance: non-pharmaceutical illicit forms of synthetic opioids are sold as a powder, spiked on blotter paper, mixed with or substituted for heroin, or as tablets that mimic other less potent opioids. Then we have morphine. The combination for it is Doramorph, Miss Emma, Monkey, Roxanol, and White Stuff. Morphine is an opiate derived from the poppy plant. it is classified as a narcotic and is commonly prescribed to manage pain. And it says over here, morphine is commonly available in the form of a tablet, syrup, injection, or as a suppository. Depending on its form, morphine may be injected, swallowed, or even smoked. And then you have opium. Auntie Emma, black pill, Chandu, Dover's powder, dream stick, easing powder, G, gondola, Goric, Gumma, midnight oil, Mira, Pin Yan, Pin Gone, Tox, Ski, Toxie, Winchi, and Zero. Yeah, those ones you don't see that much opium anymore. So that's those are all new to me there. An opioid or narcotic made from the white liquid in the poppy plant. Typically, opium is found as black or brown block of tar-like powder. It is also available in liquid and solid. Let's see. Now, so how do opioids affect the body? Opioids act on opioid receptors located in the spinal cord, brain, and other parts of the body to reduce the body's perception of pain. In addition to relieving pain, opioids can also stimulate the brain's reward regions, creating a sense of euphoria and well-being, which is thought to be a contributing factor for potential misuse and addiction. In addition to relieving both physical and emotional pain, use of opioids can lead to constipation, nausea, vomiting and dry mouth, drowsiness and dizziness, confusion, depression, low levels of testosterone that can result in lower sex drive, energy, and strength, increased sensitivity to pain, itching and sweating, tolerance, needing to take more of the medication for the same pain relief, physical dependence, having symptoms of withdrawal when the medication is stopped, and then opioid use disorder or OUD, a medical diagnosis related to mild, moderate, or severe reliance on opioids. Everybody once got a certain. The dealing with addiction and opioids is that it's like everybody. How can I explain this? Everybody wants to feel a certain way, right? And this is where addiction really comes from. For me and for anybody I know of them out there, it's not just the fact that we're withdrawing. It's the fact that when we wake up that day, even if we have something in our system, if we wake up that day and we'll feel a little off, right? We don't feel right. We don't feel like we're normal. You see what I'm saying? We don't feel like we fit in with people. We don't feel like maybe for me, I shake a lot, and opioids would take that away, and it made me more confident. It made me happier, right? And that's just the way I thought that we should be. I thought everybody was like this. I thought normal people felt this way every day, and that I was missing out on this feeling by just being messed up in the head, not having the right chemicals. So when I took opiates for the first time, well, for the first few times, the first time it floored me, and I could hardly even walk. But once I got used to it and started taking it, because my wife at the time was taking it, and because she just had her son, and they wrote her Percocets for that. And when I took one and got, it didn't make me sick. It's just the feeling it gave me was the feeling that I thought I should have had from day one, from since I was born. It was I wouldn't say it's a calmness. I wouldn't say that. I just felt normal. To me, I felt normal. I felt like, okay, everything that was bothering me is gone. You know what I mean? And this is how normal people felt. That's what like literally the first things that popped in my head. I'm like, wow, okay, this is how normal people felt. Because before then, I was on medicine for ADHD, and my doctor just died. I still have yet to get written anything for ADHD. They won't write it to people who have addiction, so I'll never get wrote that again. But so I was feeling completely different than what I'm seeing outside in the real world. In my head, this is what I'm thinking, right? I'm like, man, okay, I'm not like everybody else. I don't fit in with everybody else. But when I take these pills, I do. You know what I mean? I can get along with everybody. I'm joking around with everybody. I'm having a good time with everybody. I want to leave the house. I have no problem concentrating. You know, and once I took enough of them, that's what happened. And so that's how I started taking them. You know, was because of that reason right there. You know, and I thought it was unfair that me not having my medicine for my diseases, my mental diseases, I thought it was unfair that everybody else in this world could go about doing everything that they do on a daily basis and not have this problem that I have with my mind. You see what I'm saying? And so it was very easy for me to get addicted to these pills, right? Because I mean, I thought that this was normal. I thought that I was supposed to be this way. And you know, it's like the grass is greener on the other, always greener on the other side, right? So um, I'm sure that you guys, a lot of you guys, you know, probably don't even understand what I'm saying, right? I mean, you guys know that everybody has problems. Well, I mean, I was a young kid, and that you know, I thought I was the only one having these problems, and that's why I became addicted to these, and that's why it grabbed a hold of me for so long. Is because I couldn't give up the fact that I was messed up, and that it was normal, that it was okay to be messed up, that it was normal to be messed up, and it was normal to go through these things. And the way that I was doing it synthetically is not the answer that I should have been going for. I should have been learning how to cope with life without it. Okay, so anyways, let me get back to this. What makes opioids so dangerous? Says when taken as prescribed by a doctor or for a short period of time, opioid pain relievers are generally safe for most, but not all people. Because pain relievers produce a sensation of euphoria and well-being in addition to pain relief, some people take them for longer periods of time and increase the dosage in order to not only reduce pain, but to achieve the euphoric effect that they experienced when they initially started taking them. the What I want to say about that is that usually, from my experience, is that if you're in pain and you need the pills, right? You need opioids to relieve your pain. As long as you have that problem, as long as you physically need these pills, usually you don't become addicted to them, right? I mean, you have to. Addiction, like I was telling my dad today, addiction is abusing these drugs, right? It's not taking drugs like you're prescribed. It's abusing them. And abuse means that you're taking this stuff in a way or doing something in a way that it affects your life in negatively, right? Negatively. Jesus, I can't speak today. Negatively. So either taking too much or anything that affects you negatively. that means you're abusing it. So as long as you're taking it as prescribed and you need it, usually you don't get addicted to these, and usually they're pretty easy to come off of. I just want to say that because a lot of people get scared to even take these things, and as long like I said, as long as you need them, obviously go with whatever your doctor says, but usually if you need them, as long as you quit when the pain quits, you should be all right. Says these medications can be misused in several ways. Taken in larger quantities or administered in a way other than prescribed. An example, snorted or injected. Taken without a doctor's prescription. Used with other medications, drugs, or alcohol that can depress breathing. When these medications are misused, the risk of overdose increases because they depress the body's respiratory system to dangerous levels. Taking opioids with central nervous system depressants like alcohol, sleeping pills, or benzos like Xanax or Klonopin can further increase the risk of an overdose and death. Over time, a person engaged in problematic opioid use who has developed a high tolerance for opioids will need them just to feel normal. They feel they have to use opioids even though they may no longer get any pleasure from doing so, and worse, they experience withdrawal when they don't use them. And worse, experience withdrawal when they don't use them. Yeah, I mean, with opiates, it's out of your system very quickly, usually within about 8 hours. And you're not feeling it way before then, but I'm just saying it's usually out of your body um, within 8 hours. Now, I mean, they can still find it with drug tests, but drug tests test for certain proteins. If you're taking it or not, it doesn't actually test for the drug itself. So yeah, as soon as that drug goes out of your system, we're sick. We're sick. I mean, that's just the way it is. And withdrawal means feeling sick from the lack of opioids if the body is dependent on them. Symptoms can include diarrhea, vomiting, fatigue, cramping, anxiety, and severe sweating. Some people describe it as similar to having a severe case of the flu. I mean, that's exactly the way we always described it. If you're snorting them, you'll have other things wrong with it, like you'll have sinus infections all the time. Like every day I had a sinus infection because I was snorting these pills and they would eat up my sinuses. And so as soon as I stopped snorting pills, I would get a sinus infection. And then it's funny because when you snort one, it gets rid of the pain, but it also gets rid of all that. I mean, that's how powerful your mind is that it wants it so bad that it makes up all these symptoms. It don't just make up all these symptoms, it allows all these symptoms to happen. Like it allows me to get sick, with infections. But as soon as I snort that first line, it goes away. Like it just, about every bit of it just completely goes away. It's like I never had it. And I mean, your brain controls everything in your body, and people don't understand that. People take it for granted, and they don't understand that thinking a certain way, whether you're doing it subconsciously or consciously, it affects your body. And that happens with emotions, that happens with addictions, that happens with um, even luck, right? I mean, if you think you have bad luck all the time, you're going to have bad luck all the time. You're going to see, if you see the negative in everything, that negative things are going to happen to you. That's the way life is, and it's really because of your brain. Your brain sees that and everything because that's what you're thinking of. That's why they always tell you to try to put a smile on your face all the time and try to be happy all the time and try to think see the silver lining and stuff, right? It's because of that reason. It's because, if not, you're going to be only seeing bad. Okay, we got off topic. So, anyways, let's go back. It says, in cases where an individual has stopped using opioids for a period of time due to detox treatment, incarceration, or other reasons resulting in abstinence, tolerance will be much lower. If the person resumes taking opioids at the level they were accustomed to, he or she will be at high risk for an overdose. Yeah, that's my last two friends that died. That's why they died. They were incarcerated for several months, and once they got back on the street, they tried their best to be clean for as long as possible. It lasted like maybe a week, and because when you're incarcerated, you don't want to be clean. You have to be clean, right? And when they got out, they decided to go straight to fentanyl, use a bag, and they were finding them dead the next day. So, I mean, it's awful stuff. I guess we're almost finished here, so I guess I can hurry up and do this. This paper here talks about the opioid epidemic and how it happened, and I will just go through it real quick. The opioid epidemic refers to the dramatic increase in the use of prescription RX and non-prescription opioids in the United States, and the subsequent exponential increase in the number of overdose deaths from that use. It was a perfect storm beginning in the 1990s when doctors wanted to address chronic pain experienced by cancer patients and others. Pharmaceutical companies introduced opioid pain relievers with the approval of the FDA and aggressively marketed them as non-addictive. During the same time, the pain scale was introduced as the fifth vital sign, asking people to report their subjective pain experience on a scale of none to intolerable. Doctors began prescribing opioids to address the patient's prescription of pain, even though there was little evidence that these drugs were effective when taken long term. In addition, these medications were also preferred by insurance companies over other more costly treatments for chronic pain like biofeedback, physical therapy, and massage. As a result, doctors began to prescribe more opioids, not only for chronic pain, but also for acute pain related to injuries and dental procedures. This meant more pills were available to be diverted, and it says in parentheses, to another person for any illicit use or misuse, in parentheses, used in a way other than prescribed or without a prescription. Many people who took the medications as prescribed found themselves dependent on opioids and would ask for refills. If the doctor refused to write another refill, patients turned to other sources, including pill mills, which were clinics where they could easily get an opioid prescription, or doctor shopping, which is going to multiple doctors to get more prescriptions. While many people who were legitimately prescribed these medications became addicted, others began using opioids for recreational purposes or to self-medicate as a way to address uncomfortable emotions and problems. This was more likely to be true of teens and young adults who were already using marijuana and alcohol. Although untrue, many people using opioids recreationally perceived the risk as lower than heroin due to the fact that these pills were often legally obtained, made in the lab, and prescribed by a doctor. Doctors became the drug dealers after, in the 90s, and they, not so much now, but in some cases there still are. If I wanted a pill, I could easily go get one. It's just not like, yeah, the supply went down, but there's always going to be a demand for it, and there's always going to be supply out there as long as they keep writing them. And if they don't, then this is the next section. This is what happens basically. It says, how does dependence on pain relievers turn into heroin or fentanyl use? While steps have been taken to curb access to opioid based pain relievers, the epidemic continues, fueled by heroin and fentanyl. There are a few factors contributing to the rise of heroin and fentanyl: changes in prescription opioid availability, the purity of heroin, and economics. Many efforts are underway to address the opioid crisis, including educating doctors on addiction, the risk associated with opioids, and pain management options available that do not include opioids. Additionally, prescription drug monitoring programs have helped to reduce doctor shopping. Changes have been made to prescribing guidelines by the CDC and others, and law enforcement has cracked down on and persecuted pill mill operators. Further, consumers have been advised to safeguard and safely dispose of medications. The net result is that there are fewer prescription pain relievers available for misuse and diversion. As tolerance grows, meaning that a person needs more prescription pain pills to achieve the same effect, the expense associated with paying for the pills and finding doctors who are willing to prescribe enough of them has become more difficult, in large measure due to the actions explained previously. Prescription painkillers and heroin are both opioids, but heroin is much cheaper and often easier to obtain than painkillers. For example, in some parts of the country, a prescription pill can cost $30, while a bag or fold of heroin can be $4. In addition to economics, heroin is relatively pure, so it can be snorted rather than injected. For many people, the thought of using needles made heroin prohibitive, and that's no longer the case. They can achieve similar highs through snorting or smoking opioids. I mean, you can snort and smoke pills as well. I don't know why they're just saying that heroin's like that. Um, and as far as when I first read this, that dollar amount, $30 to $4, that was crazy because man, I've never seen a fold of heroin for $4. It's usually like $10, $20 or something like that. But anyways, there's really not much I want to add there except for the fact that when it talks about them going after the pill mills, um, they did. They went after several pill mills that I know of in my area, and they also obviously went for the big ones like in Florida and stuff. There's still pain management places that write pills and stuff like that, so you can still get them. Like I said, it's much harder now. The CDC has changed the guidelines, but they reverted some of them back here recently. Matter of fact, to where they're allowing more opioids to be prescribed now. And the big thing that I want to say about the pill mills is that the problem with that is that as far as I know, anybody around my area, and they didn't do crap to any of these doctors. And these doctors knew what they were doing. I mean, you can lie, they can lie all they want. They can say they didn't know. I mean, come on, they're supposed to be doctors, they're supposed to be the best in their field, right? They know what addiction is. Addiction's been around for a very, very long time. Morphine's been a problem for a very, very, very long time. Heroin's been a problem since the Vietnam War, right? In the United States. So I mean, they knew exactly what addiction looked like. They knew what it was going to do. The companies decided to say they were non-addictive, like OxyContin and stuff like that, which we went over that already in another video, so check that one out. But they knew, these people knew what they were doing. They put greed over their patients' lives, and this is what happened, right? And the sad part about it is, and like I brought it up in the other video, what makes me so upset about it is the fact that we as addicts are seen like the problem. We're seen as we're the problem, right? It's our fault. It's our fault that we took the medicine that these doctors prescribed to us and told us that they were non-addictive. it's our fault that we became addicted to this medicine because the doctor told us, hey, here, continue taking this, and when we didn't need to continue taking this. We put our trust in people that we thought were there to help our lives, to enrich our lives, and when in turn they were there just to make a dollar off of us. And they have nothing happened to them. Nothing happened to them. I mean, there are still doctors in my area. Matter of fact, my doctor that I go to prescribe pain pills. I mean, that's one of the first places I used to get pain pills from is the doctor that I'm going to now that is trying to, that writes Suboxone and everything else to help people get off pain medicine. So not only did he make money through pain, being sort of a pill mill, right? He's making money now, trying to clean it up. And nothing happened to him. Nothing. No, they never even brought any charges to him. They never even slapped him on the wrist. No DEA came to him. Nothing. I mean, nothing happened to any of these doctors, and it's a double standard, and it's ridiculous, and it needs to stop. I mean, this stuff needs to stop. Anyways, that's everything on opiates that I wanted to bring up with, and if you do have problems with opiates, there are medicines out there that help. Suboxone is a really good one. There's I can't think of anything off the top of my head right now for some odd reason. But there's several that you can use to that will help with your detox. That will help come off these opiates. There's no reason to continue taking opiates anymore, except for the fact that you want to. I mean, that's the only reason why, right? I mean, if you're addicted to these things, there's ways to coming off of it if that's what you're wanting. So please look into that. Please ask your doctors, ask your addict friends. They'll tell you how to do it. So, anyways, have a good day.